No, you guys all seem really nice. I'm afraid of the camera, and I don't love the idea of posting this on a website. But anyway, so my name's Angela Runyon, and I'm a speech-language pathologist. That's what I do, like, as my job. But I have this other really important job. I'm a mom, and I have a 5.5-year-old son named Lucas, who's come here for BioTouch, and I have an 8.5-year-old daughter named Annalise, who has also come here for BioTouch, and I may talk a little bit more about her later. But first, I'm going to start just talking a little bit about autism and a little bit about, I'm not going to talk about any of the new research right now, not necessarily, there's kind of a lot going on. I'm going to give more of a little bit of a broad picture of autism, a little bit of the changes that have come about since the diagnostic manual, the DSM-4, then became the DSM-5, diagnostic. I'm not sure what DSM stands for, but it's just the statistical manual that all psychologists and all mental health professionals use to diagnose any kind of mental health and other syndromes and diagnoses. So in DSM-4, there was autism, and there was Asperger's, and there was pervasive developmental disorder. And a lot of people thought that there was a really big difference between these things. And I think that as more kids got diagnosed and we learned so much more about autism, we realized that this is all just under one umbrella. And so when they rewrote the manual, and it just came out, I believe, last year, maybe the year before that, they just changed it to autism spectrum disorder. So now everything, autism, Asperger's, and pervasive developmental disorder, it's all called autism spectrum disorder. So, kids that are now getting diagnosed, they're diagnosed with ASD. You certainly can talk about having moderate ASD or severe ASD, and there are other diagnoses that can come along with autism. So you can have autism, and you could also have mild or moderate mental retardation. But these are kind of separate pieces, and so what they really wanted to focus on was what autism is. So one way to think about autism is a three-legged stool. And if one of these legs isn't there, then you don't have autism. That's just, that there's something else. So there's, it could be a pragmatic language problem, and pragmatic language is the social rules of language and things like that. And I have worked with some kids that really have just pragmatic language problems. So anyway, the three legs of the stool are restricted interests, communication problems, and problems with social interactions. So, if you only have problems with communication and you only have problems with social interactions, then it might be more of a pragmatic language disorder. You have to have that repetitive and restricted interest as well to be qualified as on the spectrum of autism. So, and all of these legs they look really different through the lifespan. So, a 3-year-old who has restricted interests may be lining up cars instead of playing with them, maybe opening and closing cabinet doors, repeatedly, things like that. But what that turns into as kids develop, and when and if they develop language and communication, then that could be a child that really only wants to talk about the Titanic. And all the stuff I talk about, these are all kids I worked with. So, I used to work with a kid, all he would talk about was that was it. So if you wanted to talk to him, and you could have a conversation about the Titanic, you could try really hard to veer off the topic and maybe talk about some related things, and sometimes that went okay. But as you can imagine, this gets to be really difficult when kids get older, preteen years, teen years, and beyond. It's really difficult to have such a restricted the amount of things that you're willing to talk about or discuss, and these kinds of things. So I think that the woman who asked what actually is autism, I think that that's maybe the easiest way to answer that, if you think of it as a three-legged stool. And so all of the kids that I've known in my life, and I've known a lot, probably hundreds, they all have specific difficulties with all three of those areas. And so the communication piece, it can be all the way from children that are 18 months and they know their alphabet and they know their numbers and they're starting to teach themselves how to read, but they don't say mom. And when they want a glass of milk, they don't say want milk. They have a temper tantrum. And so, but that can go all the way towards, all the way to children that are completely nonverbal and they don't speak at all. And so I've worked with kids that use sign language to communicate. I've worked with kids that use pictures to communicate. I've worked with kids that have used communication devices to communicate. And if you're not familiar with that, an easy way to think about it is like an iPad that you touch symbols or buttons and it talks for you. And so, I think the other thing about autism, besides knowing about the three legs of the stool, is that when you have met one person with autism, you have met one person with autism. It is amazing the huge spectrum of differences that kids have. And so, I think that in some ways I understand that all these kids are lumped under this thing, but it's because of those three legs. Because otherwise you would look at these kids and be like, there's no way that these guys are, having the same difficulties or whatever, because it can look very, very different. I think that oftentimes when autism is portrayed in the media, movies, TV shows, which by the way have gotten a lot better than they used to. So I'd say maybe 10 years ago the way it was portrayed. I feel like they really focused a lot on sensory issues and kids waving their hands in front of their face and having specific sensory needs that they're trying to get met, and that absolutely can be a piece of it. But it has nothing to do with the diagnosis of autism. It's not, you don't check in the diagnostic manual, does the child wave a hand in front of, their face, or, does the child, is the child very sensitive to loud noises? And, now there's a couple of kids at my daughter's school and they wear headphones, because they are sensitive to loud noises. But that's not autism. Certainly there are lots of things that go along, that can go along with autism. They can co-occur, the sensory problems. And also, certainly as kids get older, a lot of anxiety. A lot of kids with autism, 9, 10, 11, 12, 19, they can have a lot of anxiety, social anxiety, because maybe they know that they're not good at it. Or maybe they're so confused by the whole experience, they don't really understand the social rules or the scripts. So, I worked with a kid. I lived in Sweden for 3 years, and I worked at an international school. And I worked with a really great little boy. I loved him so much. And his favorite time of the day was lunch, which in some ways can be kind of funny because, kids with autism, they struggle with the social aspect and whatever. And we would sit down and have these meetings. He actually had a one-on-one aide that was with him that I worked on training. And, the mom would come in and people from the commune would come in. We'd have these meetings and we'd be problem solving and talking about Runyon. His name was Runyon. Trying to figure out, what made him upset and what were the things that helped him be really successful. And one of the things we talked about is he really liked lunch because he really understood what he was supposed to do. He really got it. You get your plate and you go up to the person serving lunch, and you get the food and you say thank you, and then you get your drink and you go back to your table and you eat for a period of time. But then after he'd been sitting there just a few minutes, then he would get back up and he wanted to do the whole routine again because he understood it. He really got it. He was like, I know how to do this. I don't know how to play with kids. I'm not quite sure. I don't even understand really what circle time is and what I'm expected to do and what other people are going to do. It's all very kind of scary. And I think that sometimes, when parents or professionals or other people are trying to think about how to help kids with autism, try to put yourself in their shoes where you're just, you think about, in your day, you have so many interactions with people and you understand. You understand exactly how to have these interactions. And you're always thinking about other people and you're thinking about what they're thinking about. And, you know that they're going to say hi and ask you how you're doing, and then you're going to do that, and then you're probably going to go off to your meeting or whatever. It's all very, there's so many social scripts that we follow. We take it for granted that we know what to do. And a lot of these kids, they just don't know what to do. So, one thing that definitely can go along with kids with autism is anxiety. They just have a lot of anxiety. They don't know what to expect. They don't know what's going to happen next. They're not quite sure. Maybe they hate getting their teeth brushed, and they don't know if that's going to be going on forever. Are you going to be brushing my teeth for, how long is this going to go? Well, what if you sang the alphabet, when you were brushing your kids' teeth every night, and so they knew that it was only going to last this amount of time, and after time, would they struggle less? And I just feel like working with kids with autism, it's so much trial and error and trying something out and seeing how it works, because a lot of the stuff that they struggle with, the social communication piece, the language piece, and having the restricted interests, it can make it very difficult to know these kinds of social scripts and things like that. So I think I'm gonna stop talking about autism for a minute.